Y'all can start us off by just kind of maybe summarizing some things that you would like for the group to have as they leave, and what you see as maybe some strategies to begin working on.
I just like to,
the mic.
excuse me, I just like to make, I don't know that it's working. Is it working?
This one's alive. It's loud.
Now it is. Yeah. Can you hear me now? I'd like to know how many people have dogs that they let out and to run around in the woods and whatnot. Do you bring them into the house? Do you? Don't. Okay? I mean, how often do you check them for ticks? Good. That's an educational thing that people need to know, and that might be something you could do at a county level, just put out a notice about that, and you know. But I think that a lot of people are getting ticks on them because their animals are bringing them into the house. And the cats for sure are bringing them in, so.
I'd like to follow up on that with just a quick statement that, as I was driving down here this morning from Boone, as I came into Chatham County off of 421, I was, as I always do, not minding the road and looking at the landscape. I was wondering about livestock. You mentioned that earlier as we were sitting there talking. When you talk about multiple use landscapes, if you have significant amounts of livestock that you do not treat for tick-borne diseases, how would it compare with the number of deer? How many ticks are out there, and you're basically promoting the production of ticks by having livestock that aren't treated? Now, I don't know, maybe people down here in Chatham County take better care of their cows than we do in Lincoln County. But at the same time, I've suddenly, as I was driving in this morning, looking at these cow pastures, and I was just wondering, I don't know, is there anybody in here who's got an active beef cattle farm going on down here? Or do we have any numbers on that? I mean, is that part of the issue?
I do know there is an active, there's a lot of dairy farmers. I don't know what that number is, but I think it's significant. But my question back to that is, are the same ticks associated with larger mammals associated with the cows?
That's an interesting question. I don't know the answer to, but I would not be at all surprised if there's some literature out there that would address that, at least in a general sense.
I think I might be able to say a tiny bit about that. The cows and horses certainly do get Lone Star ticks and ixodes, the black-legged ticks, and probably they would get, I don't know. Would they get dog ticks? They might occasionally.
I doubt.
But not much, probably not much.
But I think,
yeah. But they do, and they do get some of the diseases. And I think, I don't know really about the cattle, except for reading in general, because I read quite an extensive book on controlling Rocky Mountain spotted fever when it broke out in the Bitterroot Valley, and the cattle were an issue there. And so a lot of control efforts were put in place there, dipping cattle and so forth. And of course, Texas had their big famous outbreak. And I think, I really, as I said, I have no personal basis for this, but I think that probably there is attention to that because the animal owners, the horse and cattle owners, don't want sick animals. Plus, I think there's so many more times deer here than cattle that might not be, it's an issue and it's a problem, but it might not be a huge one. And I wanted to make a comment about the ticks on animals. We get, again, we being the Tick-Borne Infections Council, we get calls sometimes from people in the winter. What's going on? My cats come in, my dogs come in full of ticks, and they used to not have ticks in the winter. And that started about 10 years ago when there were enough black-legged ticks that, of course, their active period, which I'm not sure has been mentioned today, the adults are active in the winter. And I have actually seen mating pairs of black-legged ticks on cats in the winter. So in general, just teach your friends and yourselves, if you have ticks on your pets in the winter, they're probably the Lyme disease tick.
Can I just pick up on that point? One of my pet peeves is dealing with journalists and trying to explain that kind of thing to them, that there are some very simple differences between a Lone Star tick and a black-legged tick, particularly when the adults are active, and that has consequences for what diseases were at risk. I mean, we heard Bruce today go through a litany of rickettsias that we don't know the names of properly, and ehrlichias, associated with Lone Star ticks and not with black-legged ticks. And every time I do an interview with a journalist, I say to them, if you want a tick photo, let me give you one so that you use the right one, and they never do, and they always, they're talking about Lyme disease and they're showing a dog tick, or they're talking about ehrlichia and they're showing a black-legged tick. And I think we all should start calling them out on that. I mean, whenever I see it, I write a letter to the editor, because I say, look, this is confusing. This is making things worse, because people are getting so tangled. The web material's bad enough as it is. Yeah. But if the radio and the TV and the newspapers are screwing up the images they're using and the diseases they're talking about and the tick species and the time of year, everybody just ends up kind of permanently panicked about everything. And we need, and this follows through to, these doctors that say there's no tick-borne disease in North Carolina because they've heard something about Lyme and they're forgetting the other 9 ones. So I would urge people to be kind of less tolerant, get a basic information yourself. It's not hard. There's, several species and several diseases, and then start, expecting a higher standard of the media.
Well, I want to ask you a question about that, but related to that, that is one reason we encourage people to always keep the tick they've removed from themselves. That's one reason, what he just said. And the easiest way to do that is to tape it firmly on a card, and you write the date and place on your body. But I would like to ask you, many of our medical providers here don't know one tick from another. And of course, there's a lot more they don't know, as we've mentioned. And do you have ideas about how we could do a better job? Because I think this is a very huge need here in North Carolina, teaching our medical providers.
Well, I was thinking about the group that's here today, and I was thinking this is a great kind of multidisciplinary science group plus the public. But where are the doctors? Where are the kind of the primary care people that are having the 20-minute rushed interviews? I mean, I don't know the answer to that, how we contact those people. But, I say to my students, because my wildlife students are pretty bad at just like a tick's a tick's a tick, and I say to them, look, you guys can identify 15 different minnow species that all look identical to me, and there's some little brown bird up in the tree, and you'll say that's the less ruby-throated oriole or whatever. There's only, 4 or perhaps 5 adult ticks, male and female. The immature ones are harder, but come on, guys, get up to speed. Just the photos are on the web. The CDC's got little ID charts and things. And if you don't know, these days with email or your phone with the photos, just take a photo of it and send it to any one of these kinds of people.
I wish you would tell that to LabCorp, okay? Because that's where the doctors send their ticks.
Right. Yeah. I mean, it just drives me crazy that, what I've heard is most of the doctors just throw it in the trash.
Yeah.
That's right. I've had people say they keep the tick and they go to the doctor and he or she throws it in the trash. And then later they get sick and it's...
I want to hear from Ken about the deer, and I was wondering if we have about 11 show up in my backyard on a regular basis. My wife loves them, and I kind of scowl at them, knowing what I know. But has this been on the Wildlife Commission's radar screen about this issue, and do y'all have a thought about it, generally speaking?
The fact that deer are in your backyard?
No, well, that, but as far as this connection between the disease and deer and other animals, not just deer, but turkeys and whatever may be involved.
Yeah, honestly, we don't spend a lot of time thinking about ticks because most of our work is bigger things. But we are certainly cognizant that our constituency is not just deer hunters, because we hear a lot now from other than deer hunters, people who are complaining about deer for one reason or another, whether it's agricultural damage or ticks, or their thought that ticks are the reason I have Lyme disease or whatever. So we're aware of that, and as I mentioned earlier, we're hoping to make some changes in our deer seasons, not necessarily to reduce the deer population. Some areas that will be the effect, some areas it may not be. But hopefully we're going to get it on a science-based plan rather than a legislated plan. And often we spend a lot of time dealing with our legislature, not necessarily our current legislature, but for my entire career, we've had problems with legislatures trying to dictate to us
Well, I was just sitting here lamenting.
what our rules would be.
Yeah, I mean, you know, the fact that Bruce and those guys were gone during 2011 left a big, huge gap in knowledge and things. And so I understand what you're saying. You know, sometimes politics is not necessarily guided by science.
Right.
Let me comment on that, Leighton, okay? There was an effort to keep us from being eliminated, okay? And I had a friend that told me that he went to visit a representative in Western Carolina who I think was a lawyer, okay? And he said that, you know, we need to keep this program because it works on mosquitoes, it works on ticks, things like that. And this man said, "Do you mean they still have mosquitoes in Western North Carolina?" That's what we're dealing with, okay?
Do we have questions from the audience?
So I'm the nursing director for the emergency department at Chatham Hospital. My physicians are not here. But I guess my question is we had the surveillance talk earlier. What is the process? A patient comes in, they're showing clinical signs, the physician states that and maybe orders a panel for Lyme, Rocky Mountain spotted fever, and the other.
I go first on this one then.
But
Well,
what is it?
First of all, they shouldn't be ordering a panel because if the patient is newly exposed, which they may or may not be, I mean, they're sick, but maybe they're sick with something else, or maybe they were exposed a while back. But if they're newly exposed, their tests are going to be negative, and this is another thing we see all the time from North Carolina medical providers. Person has, and you always want to ask about tick exposure. A known bite is not necessary. You know, the CDC stresses if you have exposure. Well, here in the Piedmont for sure, anyone that lives here is exposed, unless maybe they are confined to their bedroom all the time. Literally, we're all exposed. But if you do the test too soon, they're going to be negative because they're an immune-based, antibody-based test, and so it takes 1 to 2 or even more weeks for them to become positive if the person's sick. And so the danger is not only are you waiting, you're not treating the patient, then the test comes back negative when in fact they are sick. So generally, the CDC says, especially where you're worried about Rocky Mountain spotted fever and Lyme disease too, because of course if it goes on, it's treated late, it can develop into very, very serious disease. If you think about it, if you suspect it and the patient has been exposed, treat them. Do not wait. That's how I would answer that.
Correct, but are they to do the lab results as the surveillance department wants to get that information for a confirmed case?
They can. I mean, a conscientious provider would try to get the patient back in and do an early test and then a late convalescent test, which usually, as you heard, doesn't happen. But there is some literature supporting the fact that having started antibiotics may decrease the chance of a positive test. That's somewhat controversial. But so the main point is to treat the patient so you don't have a dead patient. or a chronically ill patient. That's to me, but I don't
So
know.
reporting wise, is the health department running numbers or looking for data? I mean,
Well, you can't.
What are we
report-
doing in the way to
No,
track it?
Well, if you
in general?
don't, I mean, as you heard, if there's not a test, you're not going to have a report. No, and since here with the Lyme disease and the erythema migrans rash, that doesn't count. I mean, if the person has a rash, you can't, that's not reportable here.
Correct, but I can run data on diagnosis codes that the physicians are providing to patients and could have data in that regards.
Right. Yeah.
While we're changing microphones there, I wanted to go back to the point that was made about the media and things like that. There are some reasonably good efforts out there. Now, granted, NPR isn't your usual site for your average news, but at the same time, this spring, they did have at least 2 segments on Lyme disease that were focused on the Northeast, obviously, and Rick Osfeld's work there linking mast crops to mouse populations and also winter weather in mouse populations. And they were interviewing him and one of his former students, who I think is his wife now. But at any rate, they were talking about this and actually did a very nice job of explaining that food web stuff and the effects of harsh winters on these. Now, whether it was broadcast nationally, I don't know what that means when you have much more regionally important information, but I thought it was a very good job in doing that. Again, though, this is a different type of media than what most, I think Graham was talking about.
Yeah, there was also an article in the Wall Street Journal earlier this week on Lyme. So I wanted to make a quick, I'm Jennifer Platt with Tick Warriors, and I wanted to make a quick comment about the ticks on livestock. I do have clients that have had their cows, udders covered with ticks, and also pigs. So I've heard of pigs being covered with ticks.
With kids, you said?
Ticks.
Ticks and kids?
Pigs.
Just
Pigs.
Just oh, okay,
Ticks.
okay.
Yeah.
Pigs, yeah, not kids.
Like pot-belly pigs
Yeah.
that are in an animal sanctuary. So I have a question, a policy question. I'm interested in what is it going to take to get alpha-gal documented in terms of surveillance and how many people have it. I hear so many people in Chatham County have it, and we don't have any idea, and I don't know if it's going to take legislative action at the state level because it's not considered a disease yet. But I would love to get your feedback on that because it is a growing issue.
Yeah. Well, my first thought about that is I don't know if it has a diagnostic code yet. It might, but I don't know if it does because that's what it would do it to me.
Well,
Is
as
it-
you heard, Carl said it's an allergy. It's not.
No, but it still would have a diagnostic code.
Right,
It's
yes,
a condition.
right,
You come in and, everything's coded for
But it's not
insurance
something
purposes.
they would report.
And
to
I don't
us.
think there's one made. Do you know, Graham? I don't think there is one, because see, it's the same problem, Jennifer, with Starry, what we call Starry. There is no diagnostic code for it. And so once you have a code, assuming it's fairly reasonably accurately recorded on the patient's medical record and insurance and all that, then you can pull up numbers, using medical records. And that would be the easiest, most obvious way. And the same with Starry, if they were to ever make a code for it.
And I'll just comment, Starry is defined as being by the bite of a Lone Star tick. And so then again is why you want to keep the tick.
Yes.
I would really support that we should have a code for that.
Are y'all aware of any public campaigns that have been effective or best practice that you might want to share that have been used in other communities, particularly up northeast, where they've had such a tremendous problem?
for?
Well, just
Just-
for getting the public informed and maybe some other things where they're actually collecting data on a more consistent level.
I think the data question is where the answer to your question. I've gone around to a lot of different parks in the state, and every time I talk to the park rangers, it's, there's always somebody who's had this tick-borne disease, that tick-borne disease, or alpha-gal, or something like that. And you get the impression from talking to those people that this stuff is really widespread. I got a brother that, bless his heart, lives in South Carolina, and he, knows, according to him, just in his little community, 4 or 5 people, goes to his little church that have alpha-gal or that have had that allergic reaction. But this is all anecdotal information, okay? How are you going to make an impression on people? You ask that? Get real numbers, Until somebody puts a real number on this, nobody really knows in the end, and you can't convince them with anecdotal evidence that this is a problem. And, I don't know who the best group to do that is, but at the same time, it's a research problem, and it's not a very hard research problem to actually get real numbers on.
That's a very valid point. I mean, we hear everything about mosquitoes in the news constantly, but yet this goes terribly unnoticed.
She had a question there.
I was just going to say that in my 100-home subdivision, there are at least 5 people with alpha-gal that I know of, and there may be more. In Virginia, there was a gastroenterologist who had all of his irritable bowel syndrome patients tested for alpha-gal, and 30% of them were positive. I think there's a lot of undiagnosed alpha-gal there, because I was misdiagnosed with that for decades. And it wasn't until it got bad enough for anaphylactic reactions that ended up going to allergists to get it diagnosed. So I think there is a lot of undiagnosed people out there. But one way you could get numbers is going to the labs that do the testing and find out how many they got positive. The problem with that is, like, I get tested every year, so you'd still have to do it by names.
The problem with that I can see is that until the doctors actually have the written records and until they're told that they have to report it, they're not going to give you that information. Because of the HIPAA laws.
Along that same lines, my question was, are there hot spots? Because I live in Farrington Village, which is just down the road, and I had ehrlichiosis and almost died. And we have a nurse in our community, and I said to her, I had ehrlichiosis, I almost died. We should do another tick-borne program. And she said, oh, a lot of people have had ehrlichiosis and almost died. Just kind of like off the cuff, because we're going to only do this every other year in our community. So I was just wondering, and I know anecdotally there are a lot of people in our community who have had tick-borne diseases, Lyme, all of them. We've had all of them, including the alpha-gamma. So anecdotally, I know that we have a lot in our small little community. Are there hot spots? I mean, are there?
Well, I mean, probably, but we know there are hot spots for ticks, but there are no good studies, so really, we can't really answer that.
Not for alpha-gal.
And, well, I'm talking about any like across the state for tick-borne diseases. And see, one of the other problems that I don't think has been mentioned is, of course, a huge portion have never been or not reported of the diseases. And there are a number, about half of the 15 that the CDC lists are not even reportable. And of course, one of the big ones we have here, I think it's bigger than we even know, and I hope I get a chance to talk to you, is Starry. And it has, as I said, no diagnostic code and is not reportable and is often signed out on a medical record as an insect bite or something like that. So it makes it virtually impossible to get data and do any studies. So I mean, to get the data, which absolutely we need, it's going to have to start early on to have a system to create reliable data, because it's not out there to be collected yet. It doesn't even exist in some ways.
Well, you can come study us if you want.
Well, actually, before you go, could I ask you, could you just kind of take us through the process that you went through to get the diagnosis?
The big key for me was the state nurse that called me once my lab report got sent to the state nurse, because I was sick for a week. I went to urgent care. I had flu-like symptoms. So that's what they thought it was, even though I didn't feel like I had the flu. I ended up in the hospital for 10 days, and they didn't do the test until later, of course. So it was diagnosed as ehrlichiosis. The state nurse called me a week or so later, and she said she wanted to know everything about my treatment and how it went. And she said, did you get treated for Lyme? And I said, no. Or did you get tested for Lyme? I said, no. She said, well, did you know that in Chatham County, very often people have more than one tick-borne disease at the same time? And I said, oh, I didn't know that, and none of my providers had told me that. So I got myself a Lyme disease doctor at UNC Infectious Diseases, and I went to him and I said, okay, do I need the test? And so they did test me. Part of it came back positive, part came back negative, and I got another course of doxycycline to be on the safe side. But, you know, the medical profession was not recognizing it along the way. But the real key for me that I was so thankful for was that nurse who follows up the data and did that follow-up call with me, because she's very aware of what's going on.
So just quickly, at what point when you were in hospital did they send the test off to a lab?
Well, I was sick for a week, and I think it was probably maybe a week. It was after I got out of the hospital, I think, you know, maybe towards the end.
But they must have started doxycycline treatment.
Immediately.
Yeah, okay,
When I went in
so
the hospital, I almost died. My kidneys were greatly affected, and so they knew right away when they did the lab tests then that I was in serious trouble, and they figured it ehrlichiosis. Yeah.
I think that's a good.
I may be wrong, but it seems to me like we're talking about two different approaches to this data question. And going to the quote-unquote medical establishment to get data on something that they're not wanting to talk about seems to be a dead end. It seems to me that a weakly funded, even, but good test done by some academic someplace, resulting in a article or in a well-regarded journal, would go a long ways to provide the evidence that you're talking about. Basically circumvent the medical community to get the initial numbers out there. And then you've got something to stick in your doctor's face and in LabCorp's face and, you know, whatever.
I think that's a good comment about public health's place in this, because you had a public health nurse that her awareness was peaked about this, and I hate that Carl had to leave and Alexis, but that may be something that the health directors that are still here we can have further conversations in Raleigh about that, because that's where I think a lot of the drive is going to have to come from, is from the state public health office about looking at this, but we've got to get to the data.
Really, I just wanted to speak more to the same issue of data, and when you spoke up as a practitioner saying, what do I do for this patient? And I just have been to enough conferences or groups of people talking about these diseases, and it just seems so incredibly underreported because the tests are no good. So people, and the clinic in Hillsborough, where I live, has several doctors, nurse practitioners, and the medical director says their policy is not to test. So they don't report, and they do have LabCorp right in the building with them, and they do not test because it's not valuable to them. They're more concerned with treating the patient if they have the symptoms. So how do you get statistics? And I really like your points there.
Hi. So one of the ways that we might be able to get some data would be, I know I used to work at the state as one of the nurse consultants with TB and other infectious diseases. We frequently would get graduate students who would come, or we would get people from public health advisors from CDC who are assigned to the units up there. And though it's a great project for one of them, because they're going to be there, they need something to do, and could we not use either the community health assessments, add a question about ticks there, go through perhaps high schools or somewhere where we could do education about tick-borne illnesses. What is a tick? What do you do with a tick? To students who will then take that information home to parents, and then have a number on there. Hey, if you've had a diagnosis of tick-borne, then let's just or if you have the alpha-gal or one of these others, how about giving them a number where they can call and talk to one of these students and answer, the same set of questions for every person. Was there a tick exposure, blah, 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 but have it somewhere centralized where you can start getting at least an idea of, because we all know anecdotally of people, but getting that data in one place for one person who can then turn around and say, we have X number just here, here's the numbers from this school or that school or whatever. I mean, just a thought, that's a way to get it in one place.
We have 5 entomologists, one of them is, or a zoologist here who is sitting by us that would be interested in this, and we have 4 other entomologists at different universities in the state, as I pointed out, that will be probably working on ticks one time or another in their career. They may not focus on them all the time, but these are the types of things that if there's a pot of money somewhere, they can do this research with students. And the money is the big question. Where's it going to come from?
Well, clearly from Chatham's standpoint and the Board of Health here, there's a high level of interest in this subject matter because of the things that we hear here. So I suspect that our board is going to continue to push this issue, and I'm certainly behind it to figure out, talking to the state, looking at are there revenue sources to help pay for some studies and whatever we need to do. But I do agree that data has got to be gotten to the point where we can have somebody present a paper that we need to something. It's interesting to me that we report all these diseases day in and day out, and we've got long years of history of doing that, but something that's prevalent, seemingly as prevalent as this, we're not.
Kind of a comment and a question. My impression is that in the next decade, say, we're not going to make progress on fixing the ticks, and things will get worse. And so the first priority should be to make sure that people get treated appropriately so they don't get sick. And so I guess the question part of it is, how different is the first line treatment for Rickettsia, Ehrlichia, and Borrelia? I mean, is it the same antibiotic, or do we need to know which one it is?
It's the same, fortunately.
Okay, so I'm hearing that it's the same. So I would see the number one thing that needs to happen is that somebody needs to have explained that it is important to treat kind of on ambiguous or even absent test results. Because, I mean, doxycycline you get for acne and things. It's not like you're asking for a, cancer treatment. Is there a reason that there's this reluctance to just give some damn antibiotics the first visit?
There is reason. One is the huge concern now about the overuse of antibiotics. Okay. And of course, one thing as an aside that bothers me about that is I think it's 75% of the antibiotic use in this country is in animals, in the animal industry, and the same people often that are fussing about not using it in humans unless there's strong evidence that they need it, or not fussing to get rid of it in the animals, but that's my own little pet peeve. But that I've seen this over and over again. I think there's a message has gotten out to the medical community that they're overprescribing and to be careful, and the message of when to be balanced about that. when it is safe to wait with certain diseases, and when it is not safe to wait has not gone through. Plus that message I mentioned before, that you cannot do a test early on and get an answer. You need to treat the patient, or you might have a dead patient or severely ill patient before you get an answer.
So I feel like there's a small package of information there that don't overprescribe antibiotics, but Chatham County residents are at high risk of walking in saying, I don't feel good, I have a rash, I have a fever, I have a headache, and I got bit by a tick. And that would be a situation to be less precautionary.
And that may be something we can do locally to try to educate our local physicians that this is a methodology that, because of our unique situation here, or maybe it's not as unique as we think it is, but it appears that way.
And in Chatham, I have to say, Chatham's gotten better, the local medical providers, for a variety of reasons. One being several people have died. They're well aware of that. A child died from ehrlichiosis here just a few years ago. And so it's not as bad here probably, but again, it's just guessing because we don't have good data, as in surrounding counties and other parts of North Carolina. But across the state, it's a terrible, terrible problem.
One of the things that public health does, usually we try to do it well, is education of the public. And I guess once we get the public educated, they will demand certain things from their providers, and a lot of times that will move things.
So TNC has sent information home in report cards at the end of the year in Orange County and Chatham County, and also has very informative brochures. This bigger one that has pictures of the 5 main ticks with the diseases next to them. This one is bilingual. I know you guys put this together, and I think it's
We've had billboards up on the highways and
says something.
So with this emphasis on the media, where's the media today?
Doing politics.
So just to sort of stir the pot a little bit.
They were on the list to be invited.
Were they? Yeah, I would think. Well, this is just this type of thing. This is an event that could be used to. And maybe there are political reasons not to invite the media to an initial event like this or something like that. But, here's a bunch of people gathered and talking about this. So why not get some coverage with it?
Yeah.
There's two sides to this media thing, I guess, is the way. And we can blame the media for not being here, but did we actually try to drag the media here?
I have a question that I want to ask the experts. If you go online, it says it's a myth, but I've had people swear up and down to me that ticks will fall out of trees.
No.
I had somebody that explained to me about the muscle reflex, like when they sense the CO2 of a person. They were sitting on a picnic blanket under a bunch of trees in Duke Forest, and ticks literally fell out of the trees. And also horseback riders on big, wide trails that'll have ticks on their backs. They don't know where else they could have come from.
I'd like to answer that question if I can. At least I think that I can answer that question. There are certain places that these ticks quest. They sit and they wait for something to come by, and their 2 front legs have claws on them, and something touches them, and they grab a hold, and they're off. They're off with whatever went by, okay? But there's certain species that also climb to higher heights to quest. Like DVs can be down on grass in your front yard, okay? But if you get black-legged ticks in the deciduous forest of North Carolina, they're often on limbs, broken limbs, and things that have fallen down to the ground, and they may be as high as your waist or your shoulders. And if you walk by, you can get a tick on your shoulder like that, and they look, oh, it fell out of the tree, okay? Well, it didn't. You brushed against that limb, and it got you. And even on the horses, that might be the case too, because they're brushing every now and then, they're brushing a limb or something like that. So that's where I go with that. So.
And I'd just add that, a tick on your back could easily have just climbed up there, and you didn't notice it until it got there. I'll often...
Riding on a horse,
Oh, right.
So did the tick
Well, I mean, my first suspicion would be that it got on the person's leg when they were on the ground before they got on the horse, and then half an hour later they noticed it. I mean, I always, whenever I'm driving home from being in the field, I feel them climbing up my neck.
Even when they're not there.
Find flagging much better for adults.
My question is for you. Do county boards or county health departments have any authority to require reporting at the county level?
I'm not 100% certain as and the gut reaction is no, they don't. You don't have the authority to make a rule because there's a comprehensive set of communicable disease rules and laws, and the term is that there's a I forget the legal term right now off the top of it's been a full and regulatory scheme developed around it. So my gut reaction is no, but that's a legitimate question I can follow up on.
Leighton, is that, if we use different words like an alert or something like that, could you do it that way?
Well, I think, how do you grab the public's attention? I mean, if that's where you're going, or, and I don't know the answer to that question. You got one mosquito fly up in somebody's backyard and they get all tore up about it, but I'm looking at the audience here, if anybody's got any suggestions. I don't know, because I really don't understand it. It's always the disease du jour. It's West Nile virus, and that's going to take everybody down. And then it's whatever it is this month, but something as endemic as tick-borne illnesses, and it doesn't seem to get any attention. I guess it's like people dying on the highway. People get used to it, and they don't, and it's not something that piques their interest.
Well, that was something I was talking to Dr. Williams about this morning before we started, because before 2011, the magic year, when there were a lot of state efforts about ticks, there was some more publicity. The department would issue news releases about ticks and how to be safe, and tick season's begun and so forth. Still not much, not as much as I think they should. And I asked Carl why it's virtually disappeared. I mean, here we're at the beginning of tick season. I have not seen a single, I haven't seen a single article. And yet, as I mentioned earlier, you got the flu deaths. Oh, and here was a good one the other day on the radio. There was a warning from the state. Somebody in the state did it, that there had been last year 29 deaths of pedestrians on railroad tracks. And so the warning was, don't get on railroad tracks.
It's all over.
And yes, so we have a problem. The state is publicizing some things, so maybe that would be, again, a role for the public health directors or somebody to pressure the state and say, hey, you guys, you got to start doing something on ticks. Plus, we need local media. We need reporters, and we need to try to get people interested. And once in a while, there's a story, but nothing like with mosquitoes or flu or something like that.
And I think, too, and we did invite legislators. Of course, the session's in, and it's hard for them, to attend things like this. But I do think it would help to have a champion in the legislative house to help push this issue. And looking at my colleagues over there, that maybe that's something we need to take back and continue to push in Raleigh, because we talk about a lot of diseases, but I'm just continually amazed at how low this one's falling under the radar screen. Bruce, you going to say?
Yeah, going back to the age of public health pest management, we did a lot of visiting craft fairs, association meetings, things like that, and we would set up a booth and we passed out all kinds of information. We had live ticks to show them. We had posters that warned them about ticks that we handed out. We had pamphlets that we handed out, and almost all of that went into the dump in Raleigh when they closed the program. So, but that's another approach that you can take. You reach a lot of people, and you'd be amazed at how many people actually stop by with their kids and said, "Oh, look at there, and the kids look and say, Mommy, I've seen that at the house, okay? Or something like that. So this is another way to do education on a local level. And all you need to do, it's fairly simple to set up this kind of thing, so.
And I look at the panel here, maybe somebody here knows the answer to the question. No, CDC, we get a lot of information around diseases out of the CDC, but I don't normally see that much other than the general things. I mean, that's another side of the equation is the federal effort toward getting that information out.
Well, my feeling, I've often called the South the orphan child because the CDC, I think Graham mentioned it too, you know, most of what you see is on Lyme disease in the Midwest, the Northeast. And down here, my feeling is, of course, we have more problems and they're more complex. We've got all these kinds of ticks, as we heard, all these diseases. Yet, my feeling is that from the CDC, we get very little attention and very little help. I'm not sure why. But maybe because the Northeast is a wealthier area and more concentrated population, and there are lots of numbers, but we don't even know our numbers. We might have huge numbers too as a whole area of Southeast. But
Questions? One thing that I know that has come up around the issue of citizen science and where does that play into this, and is that a better way to go at it rather than the traditional, academic study like you would normally expect to see? And I guess going back to Ken, is there a role for citizen science to play in helping the Wildlife Commission understand deer populations in urban areas that you may not have access to now?
There is a citizen science project going on right now. It's called Candid Critters. Roland Kays at the State Museum of Natural Sciences is heading it up, and we've got a number of people across the state running what they call camera traps, what I call a trail camera, taking pictures, and they draw conclusions from that based on where the cameras are and what they pick up, what they see. So yeah, I think we're going to learn a lot from that study.
That's good information to know because it could maybe tie into some other studies about single populations and densities and those kind of things.
Right. And landscape, yeah.
In the interest of public education, I have a comment. Would you please not call the alpha-gal allergy the red meat allergy and call it a mammal allergy? Because it's not just a food allergy, it's anything derived from mammals. It could be the gelatin in your shot that you're getting, your flu shot. It can be the detergent on your clothes or the pig on your dryer sheets, the pills, the lactose in your pills, or the gelatin capsule. And plus, it's not all red meat. Emu is a bird and a red meat, and it is fine, has no alpha-gal. It's only in non-primate mammals that you have the alpha-galactose.
Never considered that.
Just while we're on that topic, how many of you have heard the Radiolab alpha-gal episode? So Radiolab on National Public Radio did a full hour interview with kind of on the alpha-gal story, and it's called Alpha-gal. If you Google that, you'll find it. And it's really well done. They had one particular woman that they kind of tracked her story, and I'd recommend it.
Any more questions?
Yeah, I have a question for Ken over here. Have you noticed the steady increase of the fire ants moving north, and have you seen an impact on the ticks in Morrow Mountain area or any area that where they've moved into? So,
Morrow Mountain is primarily wooded, probably 95% wooded, and I see fire ants mostly in more open areas.
yeah, sandy soil and stuff like that.
Yeah, well, and even clay soil, but in more open areas. I don't find them in the woods very much, so
Right.
I wouldn't expect much of an impact. Now, they
Okay.
are prescribed burning at Mar Mountain and a lot of the state parks now. They burned about 1,300 acres of the park this year, which I think from your program might help temporarily, but might hurt in the long run. Although I see the deer having an impact on the revegetation of Mar Mountain State Park, in that they suppress the revegetation. When you burn land, you get black land. Black land at Mar Mountain seems to last a lot longer than black land anywhere else because nothing grows on it. Well, it grows, but then it gets eaten. So
Well,
I've seen the
Thank you.
impact of,
Thank you.
and I've got lots of fire ants where I live, which is right next to Mar Mountain. And we got plenty of ticks too, mostly Lone Star,
Well, currently, I don't think
Baden.
south of Dayton.
currently, I don't think the possum is considered a game animal, but maybe we should reconsider his classification and.
It's a fur-bearing animal.
Just ask my relatives about that.
You
They
might have
consider it a game animal?
We're not going to stock possums.
Is that,
if
in
that's where
Lincoln
you're
County,
going.
they are a game animal, okay. You may get other problems if you bring possums into the mix, I don't know. But do we have any other questions, comments from the audience?
We have a lot of wildlife in our yard. I'm not aware of that many deer, but yeah, how big, I don't make it closer. So we've talked mostly about deer as hosts, but what about, what is the percentage or the concern with if you have a lot of squirrels in your yard or voles or mice, or how, I'm just kind of thinking about managing my own yard.
Well, you are correct. These little beasts do act as a host to these. And, since I've been dealing with ticks, and my wife has gotten very, very circumspect about not only me coming back in the house, but, every winter we get white-footed mice that come out of the woods around our house, and they come in. And I've actually given some serious thought to this. I mean, I may need to get a little more serious about, in terms of managing this. I've got an undergraduate who was looking for something to do this spring, and I put him on an independent study, and he's out looking for black-legged ticks in neighborhoods around the Boone area, because I've never looked in town, in some of these wooded neighborhoods and stuff. And, it's kind of a shot in the dark, but he hasn't found anything. Now, he hadn't got to my house yet, or to us, but nonetheless, I really don't know what he's going to find. And, they're relatively rare, as I said earlier, around that area. They're very patchy in where they're found. But, that's a very important question in terms of what types of landscapes, and in this case, talking almost to the point of landscaping, are you going to have around your house? And should you be controlling white-footed mice and things like that? They're there.
Well, another thing is bird feeders. When you read what to do to decrease deer around your house, one is not to have a bird feeder. And we haven't talked about birds a lot, but they do spread certain kinds of ticks. Certain species can vector Lyme disease, and of course the flyways. There are a lot of research studies on that, but don't have a bird feeder.
And there are species of shrubs and things that deer are not interested in, and that's another good idea.
Yeah.
I'd like to know what they are.
My neighbor knew, and we planted some of them. Apparently, they're poisonous.
They eat everything I put out.
You don't know.
They don't eat what?
Yeah, they'll think it.
Silverberry.
Silverberry.
Yeah.
One last question, and we'll close up.
This was just a comment. I think this forum is a really great opportunity for us to consider starting up a local citizens advisory committee of some sort. I know in the Northeast, especially in Maryland, they have citizen committees that are working with the health department to help keep a pulse on what's going on in the community and then work to enact policy and programs. So I would love to see that here.
That sounds like a great idea. I want to thank our speakers and the panel here. Just give them a hand of applause. I don't know about y'all, but I've learned a tremendous amount today. So, and it's good information. Maybe we can move forward and try to do a little bit better job of getting the public advised and maybe see some policy changes moving forward. Thank you, everybody, and hope everybody enjoyed it and have a great weekend. And we'll see you around.